the first question is about how was the situation before hiring us, before working with InDesk? What were the pain points that you had with handling your patient inquiries?
So because I was working by myself, really I had to do everything. I had to answer all my own calls, answer all my texts, it was just extremely busy, and I found that I was struggling as time was going on with have a balance with my life and life and my personal life.
Oh, I get it. And when did you find time to respond to patient inquiries? Was it between treatments or after hours or before starting?
Okay, so basically all of three. Before I started, I'd wake up to lots of messages. Then between clients, I was doing answer messages on my lunch. I don't really get a lot of lunches. And also then after work, right, late at night, I would answer, because if I didn't, they would just back up. So I had to kind of just try and manage to keep on top of it by answering at all times.
Oh, I get it. And how were you feeling, like having to answer all these inquiries?
Really, really stressed, very frustrated, because I didn't think there was any way out. I thought I had to do everything myself, and work for me. I just felt like I had to do everything, because probably that's my personality, that I feel that nobody else can do things the way I do. But
yeah, I totally understand you about this. So have you tried any similar services in the past, like InDesk or similar to InDesk?
No, never. I never trusted anybody to do my work, because I had to feel like I always had to do it. So.
Okay, I get it. And how did you learn about InDesk, and what did you think about the service when you first, encountered our service?
So I think it was somebody phoned me. Somebody phoned me, just asked me would I be interested in it, and at the time I just said, because I get a lot of people calling for different things, marketing and sales. So I think I had just said at the time, yeah, send me over some stuff online or email. And I to look at it, I probably had a really, really busy time, and I kind of looked at it, and then I think it was because I got followed up with another call that I just thought maybe it could work, and it was just timing really for me, that it was the perfect time that I needed a bit of help. But I still didn't think it was going to work, so I just kind of just sat on it for a bit, and then just when I went on board, it all went very well.
I get it. And about the onboarding that you mentioned now, did you have any concerns at the beginning about how is this going to work?
Yeah. I mean, obviously, I didn't think it was going to work straight away. I'm quite open to that. Things need to give it time. Well, I've never been open to giving things time, because usually I quite quickly cut it off. It doesn't work straight away. But just the fifth, something was telling me just give it more time, because it was probably more me, because I'm quite work at a fast pace. And I probably thought at the beginning, I don't know how it's going to go, but I persevered with it. And little by little, it's coming together for me.
I get it. And can you hear me? Because I think I lost you.
Yeah, no, I'm here.
Okay, perfect. And so your main concern was like if the agents will be able to take care of of your patients the way you were taking care of them, if I understand correctly.
Yeah, and probably as quickly, because I tend to answer quite quickly and in the same manner that I would answer. I thought answering my way, the way I'm quite friendly with my clients, but it's actually worked out best being far more professional than I would be with my clients. Actually prefer that now, that people are just, because there should be a boundary there. I've learned from looking at the agents' texts and how professional they are that that's probably a better business model to have than I am with my clients, because my clients may not expect as much from me, because they were messaging all the time, sometimes backwards, forwards, backwards all day. Now the agents deal with it and it's just a message, and I'm sure they don't get involved in backwards and forwards messages with some of my clients. So it's taken that away from me, that I don't need to be worrying about messaging all the time.
That's a good feedback. And how do you feel now with about our agents?
Oh, they're just part of my team now. I think they're great. And I have 4 or 5 agents that I love working with. I feel they're my team, call them my team. And yeah, very much a part of what I do now. And yeah, they're really, really efficient, good, happy with everything. And things going forward, it's all working better as I go forward.
That's great. I really liked what you said, that they are part of your team now, and I'm sure they feel the same. And I will give this feedback to them. It will make them really happy, because this is how we see our clients as well. We are a team.
Yeah, they're very good. I think all of them have kind of, there was 1 or 2 that I always thought were really good, and I saw their names and I thought, oh, great, things are going to go well. But I think all of them now, all of them, and I don't think there's nothing negative to say at this minute. I think they're really good, and they're checking with me on things which I'm quite glad about. When they don't know, because they'll learn and move on forward, because it's a long-term thing. I think, I've learned to kind of just persevere and build that relationship, and it's building quite nicely. So I'm really happy.
That's great. I mean, really, thank you for this nice words. We have worked so hard for the past 2 years to achieve this level of service, and we're still improving. And it's really good and encouraging to hear such words. Thank you, Norma, for this and for your honest feedback.
You're welcome.
How was the onboarding process for you? Was it easy?
Yeah, straightforward. I thought it was going to be harder than what it was, but I think Adriana and the rest of everybody else that was involved had already done some research, and obviously they're in this industry, clinics, and so I felt like it was quite good. I didn't feel it was taking up a lot of my time. I feel it happened quite well, efficiently, and went really smoothly for me. I never felt like, oh no, I've got to go and have this meeting, or I've got to do this or that. I felt like it just went straight forward. It was probably less than what I was expecting, but I think people were doing work in the background, like researching me and my company and stuff like that. So yeah, it was quite good. I was really happy with how it went.
I'm really happy to hear that you had a smooth process, because onboardings can be very overwhelming, especially for a complicated service like ours.
No, that was fine. And another point I made to Adriana, I don't do video calls. I never have in my life, ever. So your first, having chatted with the team, the first 2 or 3, I don't think I went on video, and then I went on video for the first time. That was my first ever video call. I don't do them because I'm quite shy and I just don't like videos, and I felt it was something that I needed to do. I needed for them to see me and kind of me to see them. So that was really good. I felt that was a bit of a personal kind of progression for me as well. So that was really nice.
Yeah, it was very nice for us as well. To see you.
Somebody and you're working with the team. It was nice for me to see the team behind what's doing the work for me. So I felt it was really good. Yeah.
Okay.
It sounds like you felt comfortable with our team, and our team is feeling excited working with you, as I have learned. So that's a really nice way of working all together.
Exactly. That's exactly. I felt comfortable enough to do that, and I don't even do that with family, so that's good. Yeah, it's all good.
Good. Okay, Norma. So I have two last questions for you. These are like pretty general. So the first one is about InDesk in general. How do you feel now that you have InDesk taking all your patient inquiries? like in general, how do you feel about working with InDesk? How they have?
Okay, so really relieved that the pressure has been taken off me. It gives me time to spend doing all other, building my business and working and in the background. So yeah, just relieved, happy because the team are great and I'm working with them, and yeah, just feel at ease and I have peace of mind knowing that the team have my back. They're they're quite astute in. I get checked with things that I know. I'm glad that they check with me, because if I thought that they would just go ahead and do something, I think they know the business enough to know that if there's anything, they come back and check it with me. And I really like that because, I've not had any bad feedback. Actually, lots of positive feedback from clients saying that, that the people are very professional, and it's really nice that they get their reminders and it's done in the way that it's done, quite just professional. And that's the big thing for me, is that they're so professional. So yeah, just all around general happy with everything, and it's really good.
That's great to hear. And feedback like yours makes it feel, whatever we did, it makes it feel worthwhile, because this is actually our goal, to save time for busy practitioners like you. And when we know that we achieve it, it motivates us to keep going.
Perfect. Yeah.
Last question. So, as I understood, we have saved you some time. What are you doing with this time? You told me that you're growing your business, but how do you use your extra time that we saved for you?
Okay, so I've got a little granddaughter. So when I'm with her, I was finding that all of my time was spent on the phone, and I wasn't focusing on family and stuff like that. I go out a bit more now, and so it makes family, because I have that time, whereas before it was like constant messages, and I felt it's just there's no point, because I can't sit there with friends if my phone's pinging and pinging. I can't just leave, not answer my phones. Again, I just do my orders, a bit of admin, and it's done in a time manner that I kind of organize a bit better. So it's just made my time, made my time more manageable all around, to get a nice balance with personal and work life. And it's taken a step back from the business, because it was all consuming, which now not, because I know I've got a team behind me that are pulling for my best interest and the business best interest. So yeah.
Great, Norma, really thank you so much for this amazing feedback that you're giving to us right now. And I couldn't imagine 1 year ago, when we started implementing InDesk, that after 1 year we will get such an amazing feedback and make practitioners' lives better. And I'm really happy that we have achieved this and you feel this way.
Yeah, I'm really happy as well. So that's all good.
Okay, so I will not keep you for more. Thank you very much for the help and for this call. I appreciate it so much. And maybe we can also do something we can have a call like this in 3 months from now and get again your feedback and see how things are going, so we can improve and make the service better for you as well.
Perfect. Yeah, that would be great.
Okay, Norma, thank you very much. And I think you're on vacations right now, right?
Not anymore.
Pardon?
No.
Not anymore. Okay.
Today she's in the clinic. Yeah. So we just got your lunchtime, right?
Yeah, but if you notice on my diary, I very rarely get lunches anyway, because I tend to work through, but I'm starting to work on that as well. So it's actually, I've still got about 20 minutes, so I'll grab a cup of tea and just, it's all good. It's all good.
Okay.
Thank you very much and have a great weekend.
Yeah. Okay, Andrew, thank you.
Thank you, Norma, very much.
Bye. Bye, Diana. Bye.